Welcome guys to my channel. Today's lecture is about molar pregnancy. Now we are in the playlist of reproductive diseases. So when it comes to reproductive diseases, I will only explain about the reproductive diseases. It's either a pregnancy disorder or a placental pathology or reproductive system diseases, inflammations and growth is either it's malignant or benign growth. So molar pregnancy, what's molar pregnancy? Molar pregnancy or Hydatidiform Mole is a trophoblastic disease that's known by abnormal placental growth or placental proliferation. It has two main types. First is the complete mole, second is the partial mole. So the complete mole has two main forms, which is it's either an unnucleated ovum fertilized by a single sperm and that single sperm duplicates its chromosomes. So we have an unnucleated ovum which has no chromosomes, zero chromosomes in it, with a fertilized sperm that duplicates. So if numbers of chromosomes in sperm is 23 chromosomes, there are 23 chromosomes in the sperm, which is a haploid chromosome, it's called. That haploid doubles, becomes 46 chromosomes. So that sperm duplicates. It's an abnormal fertilization. It leads to 46 chromosomes because we don't have, it's an unnucleated ovum, we have zero chromosomes, but gets fertilized by a duplicated sperm chromosome. So it's 46 chromosomes because each sperm has 23. Okay, and the second form of complete mole is an unnucleated ovum fertilized by two sperm. There's an unnucleated ovum which has zero chromosomes plus two sperms. Each sperm has 23 chromosomes. So there are 46 chromosomes. So the karyotype of a complete mole is either 46XX or 46XY. So, and there is the other type of molar pregnancy, which is called partial molar pregnancy or partial hydatidiform mole. So partial molar pregnancy is known as partial growth of the placenta simply, and it does not cover the whole uterine cavity. It has some fetal it covers actually the whole uterus, but it has some fetal parts with it. For example, some fetal limbs or fetal parts with the mole, as I will show you the pictures now. As you see on this picture that I will show you now, it occurs when a normal ovum with 23 chromosomes fertilized by two sperms. So a normal ovum with 23 chromosomes fertilized by two sperms. So two sperms has 46 chromosomes together. So 23 plus 23 of the two sperms equals to 46. And the ovum has 23, so it equals to 69 chromosomes. So it's triploid. The karyotype of partial mole is triploid. Either it's 69XXX or 69XXY or 69XYY. So those are the karyotype of the partial mole. So what's the difference between complete and partial mole? Complete mole, some unnucleated ovum is fertilized either by one sperm that duplicates or two sperm. But partial mole, a normal ovum fertilized by two sperms, so a nucleated ovum with 23 chromosomes, fertilized by two sperms. Okay. As we say, the complete mole has diploid number of chromosomes, but the partial mole has triploid number of chromosomes. And in complete mole, the presentation, it has severe hydropic villi in complete mole, but in partial mole there is a minimal hydropic villi. In complete mole there are no fetal structures beside the growth, but in partial mole there are fetal structures beside the growth. And in complete mole there are higher risks of choriocarcinoma, but in partial mole, there are lower risks of choriocarcinoma. So what's the presentation of mole, Hydatidiform mole clinically, or the symptoms of Hydatidiform mole? First, very high HCG, human chorionic gonadotropin, as a normal pregnancy, which leads to elevated beta HCG, but in cases of molar pregnancy, it's elevated much more than a normal pregnancy. Sometimes it may reach 100,000. Okay, severe pregnancy symptoms and pelvic discomfort and first semester vaginal bleeding, increased uterine fundus size for gestational age. So the fundus size of uterus is much more increased than a normal fetal age. So a patient comes to you, tells you that her gestational age is, for example, 20 weeks. But for example, let's say 10 weeks, but you may see the fundus height is for a 20 weeks pregnancy or 15 weeks pregnancy. So the fundus size is increased comparing to the normal gestational age. Okay, and there's a grape-like mass in vagina or adnexa during examination. You may find a grape-like mass in vagina or adnexa, especially at complete mole. So, what are the diagnostic steps for Hydatidiform mole? First, serum beta HCG levels. Okay. Second, transvaginal ultrasound. So, on transvaginal ultrasound, you, as we know that the beta HCG will be elevated, and on transvaginal ultrasound, a heterogeneous mass with anechoic structures in it will appear. Okay, this is called a snowstorm appearance. Snowstorm, or sometimes it's called a honeycomb appearance. Okay, it appears as a snowstorm or a honeycomb or a cluster. So the mass has cluster appearance. On radiologically, the mass is heterogeneous with anechoic structures inside. So, what are the differentials for Hydatidiform mole? We know that now we studied the definition of Hydatidiform mole, and we explained the presentation of Hydatidiform mole, and we explained the diagnostic methods of Hydatidiform mole. Now we will explain the differentials of Hydatidiform mole. So when it comes to Hydatidiform mole differentials, Hydatidiform mole, there aren't so much differentials related to Hydatidiform mole because it's not that challenging to diagnose Hydatidiform mole. Okay, but it is sometimes challenging to diagnose choriocarcinoma. We have a separate lecture about choriocarcinoma. Okay, I will make a video about choriocarcinoma. So the differentials mainly are any uterine choriocarcinoma. So the differential is choriocarcinoma. Some doctors may find difficulty to diagnose between hydatidiform mole and choriocarcinoma, and the only way is histopathologic examination or histopathologic tests, because both choriocarcinoma and hydatidiform mole lead to high beta HCG and severe pregnancy symptoms. Okay, and what's the treatment? The treatment is either dilatation and curettage with methotrexate 15 milligrams per body surface area. Okay, so what's the function of methotrexate for the treatment? What's the role of methotrexate? The role of methotrexate is a folate antagonist, which simply prevents DNA and RNA synthesis in the cell, that prevents the further growth of the mole. Okay, so the mole will not grow further. Okay, beside methotrexate, folinic acid is given, so toxicity will not occur. So the treatment is dilatation and curettage with methotrexate and folinic acid. But there's an important point. The growth or the hydatidiform mole after curettage or even sometimes hysterectomy, it should be sent to the histopathology lab to do further investigations for choriocarcinoma. This is an important point. Keep it in mind as a doctor. So, thank you for watching.